Your hands are washed, intro's been done. For classroom purpose, you have on simulated gloves, we're not wasting supplies. You're welcome to go ahead and pull the sheet down. Whenever she needs help, do you mind standing over there? You'll be her nurse. Okay, thank you so much. And pull it all the way down towards the foot.
Okay.
And I do apologize, I'm gonna move this a little bit closer. I would recommend actually exposing the foot because you don't wanna get it trapped. Great, now, how do you reposition your patient? Safe turning, she doesn't move. No, move her towards you first.
Okay.
Shoulders. Good. And she's really flaccid, so she's really limber. Bring legs, and now the leg nearest you, bend it up, and now cross it over. And so when you do a team turn, you go under, including supporting that arm, and your nurse goes over. So nurse, if you'll ask your nurse for help, she'll help you.
Like so.
Yep, perfect. Ask your nurse for help.
1, 2, 3.
Good, push, 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 push. Good. Go ahead and roll that pad in. Your nurse will hold. Nurse, keep a straight back so you don't have to do too much. Roll, don't get the gown. Don't include the gown. Good, push, push, push. Alright. So your nurse, you can't lay her back. Remember, what was number 1? What do you have to do with the pad?
Take it all the way out? Oh, place a new one. Okay.
Place the new one. Don't let it touch you. And I would recommend pushing that gown towards the front because we don't want her laying on her gown. Remember, we still haven't cleaned her yet. Great job. Unroll. Push, push, push. Great job. And now you're going to have catching hands. You're going to have receiving hands. So your hands are going to be as if you're trying to catch. Good, good. And now lower. Thank you. And if you pushed enough through, all you have to do is just reach over, raise her down, lift her arm. You want to get the dirty out first. So like literally raise her down and put it on her leg. See, that's not a factor. Good. So I think you're trying to pull out both at one time. Take out the dirty, roll it in, roll it in, roll it in. All right, I'll be your trash can. And now you can roll out your dirty. And why can't we leave wrinkles in the pad? Bed sores, awesome. And now you want to get your patient realigned in the bed. We don't leave them off to the side. So put her right back where you got her from, back in the center. Shoulders, good. Hips. And then I know her legs are flimsy. Get her legs right. And now you can cover up her legs, but you need to be raising the gown. So cover up the legs, but raise the gown because we have to expose her now because now it's time to do what, everybody? Clean the VRB. We're about to do our perineal care. So expose the vaginal area. And I'm going to fix her hip. Our poor little mannequin over here. Yeah. All right, is there anybody else who needs to change a pad? Is everybody good for right now? So what I'm going to do is get this mannequin station prepared for perineal care. Can I get you to be the nurse on this side? Can I get you to be the CNA on this side? You can go back on this side over here. CNA, if you'll bring your water over, be careful. If you'll bring your water station over, take it, bring it over your resident. You can raise your table, and so it's literally going over the bed. The table goes over the bed.
And this is what's going to be done during the session.
Yes, yep. So after you change the pad, the next step is to, all right, so everybody has simulated gloves on their hands. You have fresh water. What's the question you want to ask your nurse about your water?
If is it warm?
Okay, and I may have made the water a little too warm. I apologize, but just because a lot of us are going to be using this water for the clinical stations. So present your water to your nurse and ask her to check the temperature. And nurse, just do me a favor and say it's good.
It's good.
Okay, all right. Go ahead and pick up your washcloth. You're going to wet it, wring it. Oh, keep it folded. Remember yesterday with the hand and nail care skill? So fold it, wet it, wring it.
Wet it first.
Fold it, wet it, wring it out with 2 hands, wring it out well. Apply how much soap? Just one drop. You can keep it folded when you apply your one drop of soap, and if your hands are dripping, you have that towel on the table. Cause remember, if you get the pad wet, what do you have to do? You have to change it, so we don't want you getting your pad wet. Alright, and everybody, remember, outer center. So one lip down, good. It's only on one spot, and then peel. So probably face this way. Wipe down. Doesn't matter which lip, which labia, wipe down. Good, and now change, peel back. This right here. And now go to the next one. Wipe down. Even though soap is only on one spot, it counts. You can't reuse a washcloth, you're good, I just saw you.
Then wipe down all the way.
And then wipe down the center. Outer center.
They don't know by asking us to gather.
Alright, and now you're gonna rinse the same exact way. Outer center. Let's move faster. These patients, you wanna actually communicate with them too. You have to switch every time you wipe down that toilet paper, you switch.
I did.
You did?
I did.
Outer center, keep peeling back.
So I'm on a lot, so it's no more here.
Outer center, have you cleaned 3 times? Put the washcloth down. On the towel, get a new one. The towel touch you, put it back down. Next time you pick it up, make sure your arms are away from you. Come on, you gotta move faster. Dry your hands are dripping. So unfold it, large towel, just like you're at home. Large towel is used to dry. Unfold it, let one end touch the bed. Alright, tell your patient you're gonna be drying her. Outer center, don't pat, wipe down gently. Good job, ladies. Remember, no one wants you between their legs for this many minutes, and now it's time to dry, and you're gonna dry with a real towel. Good, you can now cover up her front. Don't let the towel touch you, unfold it, don't let it touch you. I do wanna pause you, so whatever, you all keep going, in the real world, you don't have to do all that shim, that
do it
moving,
how we
if
did
she's
the
gonna
washcloth.
be there to help. But you do need to move the table. Move the table over. She'll reach over, you'll go under. You don't have to do all that safe position, safe turning, cause she's gonna ensure that person doesn't fall off the bed, okay? Good. Cover up her front. Put the towel down. Move this table out the way. Good. And so now, what direction do you wipe? Good, this is still right here, you still wanna have access to it. So now, you don't have to do the safe position and safe turning, cause she's gonna make sure this person doesn't fall off the bed. Just ask your nurse to help.
The nurse help.
Okay, alright, so you're gonna reach over, nurse. My CNA's gonna go under. My CNA's gonna push on the count of 3. 1, 2, 3, push. CNA, nurse straight back. CNA, you can get her hips. Get those hips, bring them back towards you. Check on your resident, see if she's okay. Okay. Nurse, you got an answer for her? Okay. Good, and now, you can get your table closer. What direction do you wipe? Front to back. What are you thinking about?
I don't have enough.
How many do you need?
6.
Why?
One for washing, one for rinsing. I lied.
Thank you.
Never mind.
And then make sure, good. Remember, wet it, wring it. How much, you're on rinsing now? Okay. Check on your residents, you all, they're on their sides.
Is it still warm enough for you?
Kia, you're her nurse, you gotta answer. She says it's warm
Yes.
enough. Yep, good. Wipe. Now change positions. Wipe up one buttock, towel touched you, put it back down, try it all over again. Not with you there, she's not gonna fall out the bed, nurse. Okay, so now buttock, you did
I did the
center.
side and middle.
Okay, so now what, put it down and rinse. Good job, and now CNA, you're responsible for recentering your patient. Good job, we're gonna redo this, we'll use this setup again, great job. Do you understand it, Kia? Do you need to perform it? Okay. You need to perform it? You need to perform it? Come on over here. Would you please be, A's nurse?
We need to.
I'll refold them.
Okay.
For classroom purposes, we reuse the same setup. Test site, So just like it touched you, put it back down. Pick it up, keep your arms extended. Let one end touch the bed. Look at my hand. Take one hand worth of fabric, go up. There we go. And now change spots and clean her buttocks or dry her buttocks. And so we're starting right from, you just change the pad. Okay? So you'll expose the vaginal area. Good, make sure there's no wrinkles or no material behind her as you lay her back. Good, good, good. And now you'll get her recentered in the bed. And so her legs get cold. Cover the legs. So just a little bit more. Because you kind of have her overexposed for what you need. You can part her legs, but maybe cover her thighs. Great job. And I'll be over there if you need to practice. So if you two will trade places and then we'll reset your stations. Right. She's good, she's decent, she's in the center, so here you go. But you're the CNA, she's the nurse. Yes, ma'am. Uh-huh. If you'll pull the gown back up, please. I'm listening.
Us gathering our equipment is a step as well.
Yes, so you
So
missed the
the equipment will
hamburger.
not already be there.
No, just for classroom purposes, for
Yes, the
simplicity of
answer.
class. So there's I want y'all to be careful, because if you look between her legs, there's a big wrinkle at the test site, they will mark you off for that, so make sure you get all the wrinkles out the pads. Good, good, good. Wrong direction, A?
Down.
Down, what do you have to say? Correction, very good. Alright, pretend they're brand new, you just got water, you will present it to your nurse.
Could you check the water, see if it's good?
Good. Very good, that was washed.
Oh, it's supposed to be a five?
Yeah, because you're starting from changing the pad.
Okay.
No, you've already changed the pad,
Oh, you already
remember?
changed the pad. Okay.
Good. And everybody has on simulated, oh no. Same thing you got her on. Every time you wipe, what do you have to do with the washcloth? Oh, doesn't fix it. What do you have to say?
Correction.
Correction, and part her legs a little bit more, because I think the leg nearest you needs to be open. There we go. You doing okay over there, A?
Oh, I did. I did that one, but then so this is the second one, and then I'm gonna flip it, and then the middle.
You cleaned 3 areas?
Yes.
Okay, I trust you. Next washcloth? And now you're gonna rinse the same way. Oh, no. So if you ever think about turning the person with her gown up, is she dry? Did you dry her? Yeah, but the nurse doesn't want that on her. Alright, so team turn. Alright, so you're gonna go under, nurse is gonna go over, and on the count of 3, you all work together. 1, 2, 3. Alright, and now what you're gonna do, CNA, is you're going to get the hips, bring the hips back towards you. Alright, expose, and now check on your patient, see if she's okay.
Do we use different areas? for
You
this?
can, I'd rather you use them, cause sometimes there's still secretions even when you're drying.
Okay.
Good, nothing touched you, and you can, lower the gown and move your table, and then do your team turn with your nurse.
Okay. Okay, would you assist me in turning her over? She's gonna come this way.
You don't have to, when your nurse is there, you don't have to do all that shimmy that I've been teaching you.
Oh, okay,
Mhm.
okay.
1, 2, and 3. Nurse, she ain't help at all, lower back down. My CNA did not help you, nurse, no. My CNA goes under and pushes while my nurse pulls.
Yes, okay.
1, 2, and 3. And now CNA, take your hands, put them on her hips. One hand here, and now you can bring her hips back. And you can help reposition this leg if you need to, bring it forth. And now my nurse stands up with a straight back, and my CNA takes care of everything else.
Okay.
All right, check on your resident, see if she's okay.
Are you okay?
Nurse, you answer for her.
Okay.
She smiled at you and the patient on the side. She was smiling like, that's it. Alright, so now I'm a nurse. I gotta teach the CNAs to actually help. She's in position, she's in receiving position. Good job. Lower that resident down. And now nurse, great job. CNA, you're responsible for getting her back in position. I'm so proud of y'all. Yes, ma'am.
Is that a TikTok live?
No, I don't be going on TikTok and all my young folks keep talking about TikTok. I don't go on TikTok.
We've seen, I have TikTok and I scroll through it sometimes, I can see these on lives, and I thought that this may have been
I
yours.
only do YouTube, but
Oh.
like my last group, a whole bunch of 20-year-olds, they like, I went and looked for your videos online on TikTok, and I'm like, I done told you YouTube like every day, and you went on TikTok. So one day I'll get there. I just it's a lot trying to upload all these different platforms. You all do not see this magic that's happening right now. If you don't see this, come on, you can do it.
Oh, it's been legalized. I don't even feel it anymore.
My team in the back, are you all okay? Alright, patient recentered?
Yes, ma'am.
Okay. You all have any questions on how to perform perineal care on a female resident? Any questions?
No questions.
What's my catheter care song? Perfect. So now we're going straight into catheter care. So if I said that you'll go first, would you please reset your station over there? Remember we talked about the drainage bag? It does not get attached to a side rail. There's little hooks and little holes in the frame that the mattress sits on. That's where you would hang your drainage bag from. At the test site, you don't see any of this magic, so act like you don't see it now. Catheters are not this easy to insert where you just detach someone's leg. Usually there's a securing device in the real world that would be on their thigh, but you may not have that at the test site, so just make sure your catheter is dependent and untangled, so it cannot be kinked. All right, so can I get you on this side over here, excuse me. A, you're fine being on that side over there. Let me get out your way. And you all, she may not need a nurse for this one, just, you're welcome to stand over there though, but she doesn't really need a nurse. So the pad has been placed. What was the purpose of placing the pad for catheter care? So that
it won't get wet.
it won't get wet. You all have clean hands with gloves on them. Your nurses checked your water temperature. How many towels, how many washcloths? Four washcloths and 2 towels. 4 washcloths and 2 towels. So wet it, wring it. Apply 1 drop of soap. Why can't y'all learn so much in 2 days? I'm gonna miss y'all. Alright, let me get her hips situated because that's gonna annoy you. Sorry, ma'am. Alright, 1 lip down. Wipe down 1 side down. 1 side, go down. Change spots on the washcloth. Other lip, outer, and then center. Make sure you raise the catheter when you get to the center. Or you start at the top, the clitoral area. Wipe down, and then raise the catheter, and then finish cleaning the cleaning process. Okay?
So then right
So right here first, right down here first, and then with this hand right here, I'm gonna lift the catheter, so finish cleaning. You don't necessarily have to change spots, it won't fail you, just keep going in the right direction. Awesome. Washcloth down. What's the next step? Wash,
rinse.
nope, not wash, rinse. It's wash,
Wash.
wash the catheter. So wet it, wring it, apply 1 drop of soap. Just say correction.
Corrections.
Okay, good. Wet it, wring it, apply 1 drop of soap. Good job. Pinch the catheter and then glide that soapy washcloth down the catheter. Good. And now change spots on the washcloth. Repeat that 2 more times, A. Check on your resident, everybody.
Alright, are you ready?
So this hand right here, you already did the vaginal area. wash,
Oh, wash the cat.
wash, wash, wash. Okay, good. Change spots. You have to do that 3 times. You only did it twice. You only did it once. Excuse me. After wash, what's the next? Go down 5 inches. Go all the way down. I don't want your nurse marking you off. Good. And you okay over there? You almost home. You almost home. Wash, rinse, rinse. And when you rinse the catheter, you only have to rinse the catheter once. Great job over there. Hey, I see you. You just flying through this skill.
So washing the catheter is 3 times.
Yes, and then rinsing's only once. Don't forget to rinse the vagina because you're rinsing the catheter. Wash, rinse, rinse. I catch you on everything. That's what I'm here for. I do my job. You only have to rinse it once, A.
So rinse the coochie first.
Don't say coochie. Don't say coochie. Dry. All right, so wash, rinse, dry.
Rinse.
Oh, so, hey, how many times the towel will touch your shirt? Okay. I'm not sure what happened over here. You just kept
I
saying
rinsed.
washcloths multiple times.
No, that's one. That's the wet. That's the soap and it's the rinse. What?
You're supposed to use 4 washcloths. At least 3.
So we're not doing a bike? No? I do it.
1 washcloth for the vagina to wash. 1 washcloth for the catheter to wash. 1 washcloth to rinse.
Well, let me redo this.
And the reason why, we talked about her being on her misses. So every time you reuse a washcloth, you're putting blood back on it.
Alright.
Hey, give me my hug. You're out of here. It's been so fun. Let me know if your ride is here. You be safe, baby, okay? Bye, y'all. Girl, who's next? Who's next? Who wants to go home next? Okay. All right.
We have to do it to get up out of here.
Do you trust yourself? You got catheters? You got access? Okay, bye.
Thank you, Miss
Bye.
Gillis.
It's been a blessing. I'm trying to watch you over there. I'm trying to watch you. I'm coming. Bye, y'all.
I hope y'all ain't great.
All right, I'm coming. You doing a good job over here? Good.
Okay, so that was the washing.
That was wash. Okay, new washcloth to wash the catheter.
Now wash the catheter with soap.
Oh no, what's going on over there, Portia? You doing the same spot twice.
Correction.
Correction.
I'm gonna start over.
Okay.
So wash.
Y'all be trying to go home. Look at what happened at the end of the shift. Everybody forget everything. Wash down. All right, above the clitoral area, and then lift the catheter.
And then I'm doing the catheter.
Now you're doing catheter. Okay, dear. That was 1. Good job for changing positions. 2. Good job. And now check on your resident. Yes, I'm
Are
doing
you
fine. I'm okay.
That
You
was
put
3.
soap on it? 'Cause
That
that's
was
wash.
3.
Okay, good. So now what's the next process?
Rinse.
Rinse. That's why you got a new washcloth. Good.
Oh,
Ooh.
I need
Yes, that's right. You secure it first. Yeah. And so change spots because there was blood on it. You can release your hole. That'll help you change spots on your washcloth.
So washing the catheter.
So you
rinsing the catheter.
release your hold on the catheter. Release your hold on the catheter.
Okay. So I'm rinsing the catheter now, right?
You wash it 3 times. So you rinse the vagina yet?
No, this one.
So that was rinsing the vagina.
Good luck, ladies.
Good
luck.
Thank you. Your washcloth all ugly right now at this point, Lord. Portia, what's wrong with your washcloth, baby? Why is it balled up in your hand? Portia ready to go home. Like, all right,
You
so
want me to redo it, Aubrey?
what have we done so far? We did wash. Now you're on rinse.
I am.
That was wash.
Rinse. Yes.
Okay, so I need you to rinse, but keep your washcloth contained when you rinse.
Oh, no,
Now
this
rinsing
is
the
wash
catheter.
for the catheter.
That's wash for the catheter. Okay,
Yes.
go ahead.
Okay, so.
So what was your question over here?
I was gonna rinse the catheter.
Okay. You can release the catheter. Cause
But
you,
is that change? No, I
look, you
would.
can't be doing this.
Okay.
Release your hold on the catheter and change positions on your washcloth.
Okay.
And just peel back a layer.
Okay.
There we go.
1, 2,
Good.
2, 3.
Great job. So that's wash, wash, rinse, rinse, dry, dry.
Rinse, dry. 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 Alright.
So
It touched you.
Oh, Jesus.
Go slow. Dry again, and then as you take that
Dry.
towel towards you, don't let it touch you.
Dry. And then dry the catheter.
Mm-hmm. Dry the catheter. Yes. Wash, wash, rinse, rinse, dry, dry.
Rinse the catheter.
And you only have to rinse the catheter once. Good. Great job. You can give me a hug and we'll let the other person use the station. Get some rest, dear. I appreciate working with you.
Thank you.
All right, and last but not least, it's on you, my dear Rochelle.
So when you said 2 towels, is one just as a burial? Yeah, just as a burial, okay.
To catch all that collected water you use to put in old washcloths there, etc. Until you can get them into the laundry basket.
Okay.
Do we dry the catheter as well?
Can't leave anything wet for the state of Florida exam.
Okay, only once.
Only once. All right, you're all set. You can pull the gown up and the sheet down. And I'll be right over there with you. Give me a hug.
All right.
Bye, Miss Portia.
Bye. Thank
It
you
was
so
such a
much.
pleasure. You be safe. Have a safe trip home, dear.
Thank you.
You're welcome. Bye, ladies.
Bye. So you're gonna let this one.
If it's pink, it's mine. Oh, no.
Get some soap on here.
Your hands are dripping.
Hands are no longer dripping.
Good.
So now I do one side, do the other.
You gotta change positions.
Hmm?
You didn't change positions. So start all over again.
Okay, correction.
Okay, good. Wipe down, change positions.
Is it okay if I do this? 'Cause I don't
No,
want to-
because you really wanna be effective with your wiping. You wanna wipe down.
Okay.
Get in there and wipe down.
Good.
Yeah, move your legs and probably have your hips this way.
Thank you, Miss Yu.
Bye, dear. You take care. Okay. I'd be in this angle when I'm wiping.
Okay,
Okay?
alright, so starting over.
Okay. Wipe down. Put more of your pressure there. Good. Now peel back and wipe down. Peel back. You can reposition your washcloth if you need to. Wipe above the catheter and then raise the catheter with your free hand and then clean below the catheter. Good. And now washcloth up. You know your new one. So just put it behind the soap. It's the one that's messy, so you'll know. And at the test side, it'll be dry, so the others will be dry. So now wash, wash. Wash, wash.
Oh,
Wet it, wring it, apply 1 drop of soap.
wash, okay.
And then dry your hands, same exact technique.
Alright, so
Yes.
it's here.
Wrap around and pull down about 3 to 5 inches. Want to be effective, good. And now change spots. You can't keep using the same spot.
My hand slipped off.
So you're not really getting a good grip. Don't be afraid to.
Okay.
Wrap it around. So hold, pinch here with this hand, pinch with your right hand, wrap this around and glide it down. Good. 1. 2. Be careful with that sound. It sounds harsh, so don't let it hit so hard.
Okay.
Gentle glide and then let it fall. Very good. That was wash, wash. What's next?
Rinse, rinse.
Good. Check on your resident, see if she's okay.
Are you still okay?
Yes, I am. I'm cold. Alright, so now.
Rinse, rinse,
Mm-hmm.
rinse this side. And then I go like that.
Did you change spots?
Yeah, cause it
Okay.
just fell when I was moving it.
Perfect. job.
I already did this.
Mm-hmm.
So
Good job,
actually,
good catch.
and you want me to do that once?
Mm-hmm. You only have to rinse it once.
And now I'm gonna dry.
Very good. It touched you?
It did?
It did touch you. So when you pick it up slow, keep your arms extended.
Okay.
Pick it up slow, arms extended, let one hand drop on the bed, just need a finger's worth of fabric and go down. Good, and change. And then just move a little bit on the washcloth, excuse me, towel, above, and then raise your catheter, below, and new spot, and just hold the catheter and just gently glide down. If you hold it too snugly, it's not gonna move.
Okay.
So just a
So not
gentle
too
glide,
tight.
yeah. Very good, don't let the towel touch you. Cover back up your patient. HCCD and you would be done. God bless you. All right,
so
let me
much.
know when you get a test in, okay?
Alright.
All right, bye dear.
Bye-bye. Oh, actually.